Now that we've covered blood, we are going to be taking a look at our blood vessels, which are also referred to as the vascular system. So when we use the term cardiovascular for the cardiovascular system, vascular within that name is referring to the blood vessels. The job of our blood vessels is to carry or transport blood to the tissues away from the heart and then return your blood back to your heart. So there are blood vessels that carry blood specifically away from the heart, and those in general are called arteries. So if you think of A, an artery for away, arteries carry blood away from the heart. There are both arteries and arterioles. Arteries are larger, they're openings inside, your blood vessels are essentially tubes. So your arteries are larger tubes, and then the arterioles are just kind of small arteries. You also, in diagrams, so we talked about with blood how you don't have red blood versus blue blood. All of your blood is red, just different shades of red. But when we are seeing diagrams like we have here, you're going to, and when we get into the heart next, you're going to see both red and blue. The red is showing oxygen-rich blood, and the blue is used to show oxygen-poor blood. Again, that's only on diagrams to make it easier for our interpretation. So in a diagram where we have red, okay, that would be arteries or arterioles, depending on the diameter of them, how large or narrow their openings are inside. And these smaller blood vessels that we have kind of in the middle that help to connect arteries to veins or arterioles to venules are your capillaries. And depending on where they are in our body, they form these kind of webs. We call those capillary beds. They might look kind of purplish in diagrams. And then we have blood vessels that return blood toward the heart. And those are going to be either veins or venules. So veins are large, venules are small. Here you can see if we looked at kind of a cross section of your blood vessels. Here we have an artery. Okay, this part in here is the opening where the blood would pass through. So if you think of your blood vessels kind of like a straw, or a tube, a rubber tube maybe, the wall, like the plastic part of the straw, would be the wall of the blood vessel here or here. Then the part that you would drink through would be the opening, or what we call the lumen, where in this case for blood vessels, the blood passes through. So from here to here would be the wall of the artery, and then just here to here is the wall of the vein. So arteries have much thicker walls than veins do, and veins have larger openings than arteries do, and we'll talk about why in just a bit. So when we're looking at the walls of a blood vessel, they have 3 layers, or what we call tunics. The inner layer is called the tunic intima, and that's made of endothelial tissue. The middle layer is called the tunic media, and that is smooth muscle, and it's controlled by our sympathetic nervous system. And then we have the tunic externa, which is the outer layer of the blood vessel wall, and that's mostly fibrous connective tissue. It's going to be tougher and help to protect the blood vessel. Okay. If we compare the walls and openings of a blood vessel, you can see again that our arteries and our veins have 3 layers. They have this tunica intima or tunic intima, just 2 different names for the same thing, as the inner layer. If we're looking at a capillary is only that inner layer. Okay, it's only the tunica intima. The middle layer, the tunica media or tunic media, you can see is thicker on an artery than on a vein. And we'll talk about why in just a minute. And then the outer layer, the tunica externa, if you think of external, like outer, that'll help remember that it's the outer layer of the wall of a blood vessel. So looking at some of those differences, again, okay, your arteries have a thicker tunica media, or the middle layer, than the veins do. And that middle layer is also the muscle layer, the smooth muscle layer of the wall of a blood vessel. So if you think media, middle, muscle, okay, that's going to kind of hopefully help you keep that in mind with what the tunica media is for a blood vessel. The capillaries, again, are only one cell layer thick. They're only that tunica intima, the inner layer. And the reason why is that it allows them to be more efficient at diffusion or exchanging between the oxygen and nutrients going from your blood into your tissues, and then carbon dioxide and waste going from your tissues back into your blood. For veins, their tunica media, that again middle layer, is thinner than your than what we would find in the arteries. Veins also have some other features that will kind of help them out, okay, with their job. So the arteries, let me go back to those for a second. The reason for their thicker tunica media, that muscle layer, is because for a couple reasons. So they're getting blood pumped right into them from your heart. So they need a thicker wall to help them withstand that higher blood pressure. And then their job is to also help to push that blood, continue to push that blood as it's being pumped out of your heart to the rest of your body. And that tunica media layer, that middle muscle layer, helps with that job. Okay. Your veins are typically further from your heart. So they don't need as much muscle in their walls because they're just trying to get the blood back into the heart from the rest of your body. So your veins, and we'll see a picture in just a second, also, or larger veins at least, have valves inside of them to keep blood from flowing backwards, so to help it keep kind of returning to your heart. And then the lumen, or the opening, the inside of the tube of a vein, is going to be larger in diameter than arteries, as we saw back. Here we go. Back in this picture. So you can see the lumen, or the opening, is a lot larger in a vein than in an artery. So let me actually keep continuing on here. So your veins are going to operate under a lower blood pressure. And again, that is going to be because they're further away from your heart. They have, like we just said and saw when we referred back to that picture from earlier, they have a larger lumen, or a larger opening than arteries. And that's going to just kind of make it easier for them to operate under a lower blood pressure. You're going to have more blood within them to get them moving back to the heart, because they don't have that thicker tunica media layer like arteries do. So in addition to having valves in our larger veins to keep blood returning to our heart, your veins are also going to be surrounded by skeletal muscle. And the skeletal muscle kind of milks or helps to push blood in your veins and return it back to the heart. And we'll see a picture here shortly, okay? But if you ever think of, like, if you've ever gone on a long plane ride, for example, they do tell you to kind of move your feet around and move your legs around. And that's to help your blood be returned back to your heart because of those skeletal muscles kind of milking or pushing that blood through. So here we can see a large vein. This blue tube would be the vein. And you can see within it we have a valve here and a valve here. So blood will be returning, let's say that this is in your lower leg. Blood needs to return upwards against gravity back up to your heart. So you're going to have these valves again, okay? When blood passes through, if it were to push back on it, that forces the valve closed like we see here. And then when your blood is pushed through them, that valve opens up to let the blood go through. The valve, again, is going to help keep blood from flowing backwards within your veins. When you are moving and contracting your skeletal muscles, that helps to keep that blood pushing through, since your veins don't have that thicker muscle layer in their wall. We're going to watch this short video to just kind of go through some of those differences in blood vessels really quick, so we'll take a minute and do that.
Our goal for this lesson is to learn the structure and function of the three major types of blood vessels in the body. They're part of the circulatory system. They are arteries, veins, and capillaries. So let's start with arteries. Arteries are the largest blood vessel. They have a thick outer layer made of connective tissue. They're also made.
Oops, sorry about that.
Are both part of the circulatory system. And capillaries. So, the other out. So let's start with arteries. Arteries are the largest blood vessel. They have a thick outer layer made of connective tissue. They're also made of smooth muscle and endothelial tissue. This thickness supports its purpose, which is to deliver highly pressurized oxygen-rich blood from the heart to faraway parts of the body. It needs to be thicker to support that kind of demand. So next, let's take a look at the vein on the right side of the screen. So this structure has 3 layers of tissue, but the endothelial walls are thinner. So why is it thinner? Because the pressure from the heart has lessened a great deal. I'll put lower blood pressure. And by the time blood has reached the veins, it has lost this pressure and therefore actually has instead these valves inside to help catch blood as it may be fighting gravity, so it can help continue moving back to the heart. Something else that helps, in addition to these valves, to help blood travel back to the heart is nearby skeletal muscles. And skeletal muscles help the blood keep moving by contracting. So, at last but not least, we have the smallest structures, the smallest blood vessel structures, called capillaries. So capillaries are important because they connect arteries with veins. How do they do this? Well, these tiny vessels web together and they meet where arteries and veins meet to exchange oxygen, nutrients, and wastes for all body cells, either to come in or out. And these vessels are so small that red blood cells actually can move single file through them. And their walls are only just 1 cell thick. This makes it much easier to exchange materials in, let's say, your eyes, your kidneys, your bones, skin, for example. So at any given moment, about 30% of your blood in circulation will be in your arteries, 5% will be in your capillaries, and, you got it, 65%, if you do the math, in the veins. Now, hopefully you can teach somebody else about your blood vessels.
All right, so just to review that one more time, we've got arteries, which are the largest blood vessels. Veins are going to be next, and then capillaries are obviously the smallest. The blood vessels, which we have our arteries again, the biggest blood vessels, are going to take oxygen-rich blood from the heart to the rest of the body. The veins will return oxygen, poor blood back to the heart. Their walls are thinner, again, because they have a lower blood pressure. They will have valves and skeletal muscle to help return that blood to the heart. And then we have our capillaries. They are just 1 cell thick so that oxygen and nutrients can get into the tissues and waste and carbon dioxide can go back into the blood. And these numbers referred to the amount of blood volume in them. So at any given time, you've got about 30% of your total blood volume in your arteries, 5% in the capillaries, and about 65% in your veins. Okay. So if we look at that movement of blood through our blood vessels, most arterial blood is actually pumped by the heart. And that's how they're going to get through. Again, that thicker muscle layer does help your arteries to continue moving that blood through them. But then the veins that you have will use the milking action of your muscles, your skeletal muscles, to help move blood through them back to your heart. If we look at the capillary beds, there's going to be 2 types of vessels in a capillary bed. You're going to have something called a vascular shunt, and then you'll have true capillaries. The vascular shunt will be a vessel that will connect an arteriole right to a venule. Those would be used in the case where all of the oxygen and nutrients have already been delivered to tissues. So there's really nothing more for that blood to give to the surrounding tissue. So they'll just be passed right from the arterioles to the venules to get that back to the heart so it can pick up more oxygen once it's pumped to the lungs from your heart. The true capillaries that we have are where that exchange actually happens. So oxygen and nutrients will diffuse from the blood in your capillaries across the capillary wall and go into your tissues. And then carbon dioxide and waste products will go from your tissues, diffuse across the wall of the capillaries, and go back into your blood. Okay, so if we see those here, that's what they would look like. We've got right across here would be the vascular shunt. So again, if the blood from your arterial has already dropped off all of its nutrients and oxygen, then it's going to go right through here to a venule, so it can go right back to the heart. If the blood going into the capillary bed still has oxygen and nutrients, then the blood will be directed into your true capillaries, and again, that exchange through diffusion will take place. And this diagram here just lets you see what the process would be like if that blood is just passed right through that vascular shunt from the arterial to the venule. The blood is prevented by these little sphincters, these muscular valves, from going into the actual true capillaries, just so you can kind of see that difference here. We do have problems sometimes with blood vessels, and one of those problems can be something called plaque. You can see it here in this diagram. So plaque will build up sometimes on the inner walls of our arteries, and that plaque can be made from different things. It could be calcium, it could be fat, cholesterol, or even fibrin, which is used in blood clotting. The reason why that's bad is because it can cause other issues, one of which is called atherosclerosis. That is the narrowing and hardening of the arteries, and that's caused by plaque formation. So that is specifically caused when you're high cholesterol, but you're high bad cholesterol, and having low good cholesterol can be caused by having high blood pressure, smoking cigarettes, as well as diabetes. All of those can cause atherosclerosis. Arteriosclerosis is the hardening of the arteries, but it affects your smaller arteries and blood vessels. Anytime those are going to be affected, it's going to put more stress on your heart because your heart has to pump blood more forcefully to get blood out of itself and through these narrowed vessels. Next we have thrombus. A thrombus is basically a mass of platelets or fibrin that would form within a blood vessel. It's very common in the carotid artery. So when you take your pulse on your neck, you're taking it from the carotid artery. So having that blockage, that thrombus there, would cause other issues, which we'll talk about shortly. Something called an embolism is when a piece of thrombus or a piece of that clot breaks off, and it can be carried other places in the body. If it is carried toward a blood vessel in the brain and it blocks blood flow to the brain, that would then lead to a stroke, and we'll talk about that in just a minute. You could have a pulmonary embolism where the thrombus breaks off and goes to the small vessels in your lungs. That can be fatal, just as a stroke can be fatal. And embolisms can also be caused by pieces of plaque breaking off, or fat within our blood vessels, or even air. If there's air that gets into your blood vessels, that can cause an embolism also. Another blood vessel issue would be something called an aneurysm. That is when the wall of a blood vessel becomes weakened. And that can, especially if a person has high blood pressure, it can actually rupture and cause immediate death if it ruptures. Now, if we look at a stroke, which we just mentioned, a stroke is going to occur when blood flow to the brain is cut off. That can be permanent to that area of the brain, or it can be temporary if the clot is broken down. There are symptoms for a stroke, and that's not going to link for me either. So we'll just talk about those stroke symptoms instead. So sometimes people are having a stroke. They might have different symptoms, and those symptoms could mean like they might have trouble speaking, for example. They would have possibly like vision difficulty. What else? So what we use to actually spot somebody having a stroke would be to use the acronym FAST. And the F stands for face drooping. which is a symptom of a stroke. Like they can't, like the muscles on one side of their face kind of droop and they're not up in where their position where they should be. They might have arm weakness. So if you actually think that somebody is having a stroke, one of the things to do would be to ask them to hold their arms out at their sides, like straight out on each side. And if they can't do that, particularly on one side, that is another sign. You might ask them to repeat a sentence. And if they have difficulty doing that, if they meet all three of those things, or I would think even if they meet a couple of those, then it would be time to call 911 to get help. So facial drooping, arm weakness, kind of slurred speech. You may lose consciousness if you're having a stroke. It's super, super important to get medical attention as soon as possible if you are with someone and you think that they're having a stroke. So calling 911 would be best. You would get EMTs there. They can start doing some things for them in transit to the hospital. One of the things that can help would be something called TPA, which is called a clot busting medication, and it's tissue plasminogen activator is what that stands for. The T is lowercase and it should be lowercase. So when you fill that out, make sure you do the lowercase T there. But TPA is given to break up a clot that is blocking blood flow to the brain. It can be only given, I think, within like 45 minutes, I want to say, of a person starting to exhibit stroke symptoms. So that's why it's really important to get a person medical attention as soon as possible so that medication can be administered. And hopefully it can be given enough time to break down the clot and restore blood flow to the brain. Just some facts about strokes. Every 40 seconds, somebody has a stroke. 1 out of 6 people will suffer a stroke in their lifetime. And strokes are the leading cause of disability in the United States and actually the number 5 cause of death in the U.S. So knowing those symptoms, remembering fast, facial drooping, arm weakness, speech difficulty, and then getting them medical attention can really help to prevent death in the person, hopefully. If blood flow to the brain is restored quickly enough, then hopefully you're lessening the person's chances of having some kind of disability after the stroke has occurred. We've got 2 more things to talk about here. One is pulse and the other is blood pressure. So your pulse is actually a pressure wave of blood. So what you're feeling when you are taking a pulse is that pressure wave of blood. So your heart contracts, it pumps blood out of itself, and you are feeling at a pressure point on an artery. Usually you can take pulse in multiple places around the body, but typically it's either going to be the neck or the wrist. But anywhere there's a pressure point where there's an artery close to the surface can be where pulse is easily, what it tells you here, palpated, which means felt with the fingers. So usually be time for a minute. You might take it for 30 seconds and double it so you get it for a minute. But an average pulse at rest, meaning when you're just kind of sitting still and not doing any activity, is between 70 and 76 beats per minute. If a person is very athletic, their pulse at rest would be lower because their heart's in better shape. It can pump more blood with less beats. A pulse oximeter is used to read the oxygen level in the blood. They have them that can also record pulse. And O2 saturation or O2 sats should be between 95 and 100 to be normal. Under 90% indicates hypoxia or a low O2 saturation or O2 sat. We'll talk a little bit about this. We are going to be doing some things later on while we're still talking about blood vessels with COVID, because COVID is actually, it's a respiratory disease, but it also impacts our blood vessels. It can cause blood clots and strokes. So we are going to be talking about that. One of the things that they monitor with COVID patients is their O2 sat level. So because it's a respiratory disease, it affects the lungs. People can get COVID pneumonia, and then bacterial pneumonia on top of that sometimes. So it really can impact your O2 sat. So we will come back and talk about that later on. Just common pressure points where you can take pulse over throughout the body. Again, the most common ones that we use are your common carotid in your neck and your radial artery in your wrist at the base of your thumb. When you're taking pulse, you should use your pointer and your middle finger to take your pulse. You never want to use your thumb to take a pulse because it has a pulse point in it itself. If we take blood pressure, which we're going to talk about shortly, we would be using the brachial artery and using the brachial pulse to help us with blood pressure. So for blood pressure, we would use something called a sphygmomanometer or a blood pressure cuff. But what it's measuring is the pressure in our large arteries. So usually it uses the brachial artery in our arm, right above our elbow. That would be around where we would do that. And it's going to have two numbers as part of your blood pressure. Usually it's one number, we say over another number. So 120 over 80, for example. That top number is our systolic number and the bottom number is the diastolic number. So our systolic number is at the peak of ventricular contraction. So in these bottom chambers of our heart, we have here the ventricles, and we haven't talked about those yet. But when they are fully contracted to pump all of the blood out of themselves, that gives us our systolic number. When those ventricles or the bottom chambers of the heart relax and they refill with blood, that is the diastolic number or the bottom number of our blood pressure. When we're recording blood pressure, again, we're going to do a number / another number, and we need to record units, which in this case are millimeters of mercury. Hg is our symbol for mercury, and mm is for millimeters. The first blood pressure cuffs used actually mercury in them, and we don't anymore, but we still use that same unit. Okay. So the further from your heart you go, so you could actually take blood pressure. If we go back here, you could take blood pressure here at your posterior tibial artery, but it's not going to be as accurate. So the reason why they typically take it in your upper arm, right, they put the blood pressure cuff right above the elbow, is because blood pressure decreases the further from your heart you get. Okay, so that would have an impact on your blood pressure recording. So we would typically use the brachial artery. Okay. You would put the blood pressure cuff or the sphygmomanometer cuff around the upper arm. You're going to inflate that cuff. You would have this little bulb that you would squeeze that increases the pressure in the cuff. And what that is actually doing is it's putting pressure and stopping blood flow through that artery. You would then place the stethoscope, which lets you hear heartbeat, over top of the brachial artery. And you'll start to hear a sound. When you're starting to slowly release the pressure in the cuff and it's starting to let some blood flow back through there, you're going to hear a number. So when let's say you're listening to the stethoscope and you just start hearing what it would sound like as a faint tapping. When you would hear that, that's your top number or your systolic number. When that sound goes away, it gives you your bottom number. Okay. So again, when you stop hearing that sound, that would be the bottom number, your diastolic number. So if we were taking this person's blood pressure and we started hearing sounds at 120 and we stopped hearing sounds at 70, that would tell us that their blood pressure is 120 over 70 millimeters of mercury. Okay. Now, typically in class, we would actually practice with blood pressure cuffs and stethoscopes. And unfortunately, we can't do that this year, but we are going to be doing that kind of virtually. There's kind of a virtual version of this that we will be using. So you still get the experience a little bit, just unfortunately not what we would normally do. So still talking about blood pressure, the abbreviation for blood pressure is BP, and that your blood pressure can be affected by the age, the person's weight, what time of day their blood pressure is taken, as well as if they exercise regularly or if they just got finished exercising, for example, the body position. So the fact of whether you're standing up, laying down, sitting upright, all of that can affect your blood pressure. And then your emotional state. So stress can actually impact your blood pressure. It can cause your blood pressure to be elevated. So finding good ways to manage your stress is always a good thing. Next, we have CO, or cardiac output, and that is the amount of blood that's pumped out of the left ventricle of the heart per minute. So the bottom left chamber of the heart. The reason why it's that one is because that is what pumps blood out of the heart to your arteries to go to the rest of your body. PR is peripheral resistance, and that is how much friction your blood encounters as it's flowing through the vessels. If you have a lot of plaque buildup, that's going to increase the peripheral resistance because it's going to increase the friction that your blood encounters as it's being pumped through those blood vessels. And that's kind of what we have here. So narrowing of blood vessels, which could be caused by plaque in the example I gave, and having increased blood volume. So maybe not getting rid of, let's say, fluid in your body. Like if your kidneys aren't working properly and you're not getting rid of fluid like you should, that can also increase peripheral resistance. Some other things that can affect your blood pressure would be temperature, chemicals, and diet. For temperature, heat has a vasodilating effect. That means it's going to cause your blood vessels to dilate, or the opening that the blood would flow through would get larger. Cold will have a vasoconstricting effect, so it will narrow your blood vessels. So heat actually will lower your blood pressure. Cold will increase your blood pressure. Different chemicals can increase or decrease your blood pressure depending on the chemical. And drugs, medications can fit under chemicals. And then your diet can also impact your blood pressure. There are some variations in blood pressure. Normal is considered usually between 110 and 140, and diastolic between 75 and 80 would be considered normal. So, and it's going to range too, depending on the age of the person, as to what the quote unquote normal range for blood pressure would be. You don't want a low blood pressure, but you don't want it high either. So for example, 110 over 75, that would be, according to this information right here, a normal blood pressure, but it's a better normal blood pressure than, say, 140 over 80. Okay. If somebody has low blood pressure, and you kind of have a box off to the side on your notes to fill in low blood pressure, hypotension is low blood pressure. That's often associated with illness. Again, you don't want to have a low blood pressure because then your tissues aren't getting blood adequately. And then hypertension, you also, again, have a box off to the side to fill in high BP. Hypertension is a high blood pressure. That can be very dangerous if it's chronic. It means your heart's working overtime. It's putting more stress on your blood vessels. Okay. So as I said before, we will be doing a virtual blood pressure lab under the conditions. Unfortunately, it's the best that we can do for this year, but we will come back and visit this information when we go to do that lab.